Hi Wilma, this is your almost 3-year follow-up for your mini-gastric bypass with Dr. Robert Rutledge. Do you have your legal permission to put your video on the internet?
Yes, you do.
Okay, so do you want to tell us how it's been the last 3 years since you've had your gastric bypass surgery?
Yes, my name is Wilma. I'm from Canada, Vernon, British Columbia, Canada. I was a very sick person when I came to Dr. Rutledge. I was 63 years old. I had had 5 surgeries in the previous year and a half since my surgery. I had 2 knee replacements with complications following, and I actually had to be reoperated on one of them. The second one, I had a broken leg afterwards and spent 2 months in a wheelchair, non-weight bearing. Then I was doing pretty good with my knee replacements and considering having weight loss surgery, because when I was having surgery, one of the things, I spent 3 days in ICU post-op and I couldn't breathe. And the doctor said to me, I said, "Why can't I breathe?" And he said, "Well, you're too fat." And I was pretty shocked about that. I thought, well, I said to him, well, I was too fat before, but I could still breathe and I didn't need oxygen. He said, well, you need oxygen now. So I went home from that hospital on oxygen full time. I didn't keep it for more than about 3 or 4 months, but I really couldn't breathe. I really had difficulties breathing. I couldn't walk a block. I couldn't walk a quarter of a block without stopping to gasp for breath, and it got worse as time went on. Anyway, as time, I had most of those things happened around, I think the last time I was in the hospital was about January. In July the next year, I had a stroke. I woke up one morning feeling sick, and it turned out that I actually had a stroke. I had a clot in my right carotid artery that had broken loose and caused a stroke. I was paralyzed from my elbow, just from my elbow to my wrist on my left arm, and I was ecstatic. And you wonder why I was ecstatic, but I was just so euphoric because I didn't actually have all the other things like a stroke. I didn't have to go into a long-term care facility. I wasn't paralyzed and couldn't walk, or I couldn't talk, or whatever. I had a minor stroke, and they were able to fix that, and I was so ecstatic about it. And I thought, for sure, I'm having weight loss surgery, and because my life, I'm going to die here. I was ecstatic because I didn't have complications, but I knew the next thing would be a stroke, or I would be a heart attack, and I wouldn't survive that. So I really started to look into it. I had my doctor make an appointment for me. And the doctor had made an appointment with a weight loss surgeon in Victoria, British Columbia, for me. And I had to wait 1.5 years for that appointment. And I already knew that I was a high risk for surgery. I didn't think they would operate on me. I'm a registered nurse. I've been a registered nurse for 35 years. I knew the criteria for surgery, and I didn't think he would operate on me. But anyway, he canceled the first 3 appointments I had. I booked my flight and everything, and he canceled, and I thought, that's it. And I started to look on the internet, and I found Dr. Rutledge and his surgery. And when I did the research, I realized that this surgery had to be the best surgery you could possibly ever have, because of the low complications, the length of time for the surgery, which was a big consideration for me, considering the fact that a normal Roux-en-Y surgery is 3 to 4 hours long. You're in the hospital for 5 to 7 days following. I knew that a 3 to 4 hour surgery could actually snuff me out. Because basically they wouldn't have done it. So I had some discussion with Dr. Rutledge, and he said, we'll look at your case, and I started working on that. In the meantime, I had to have further surgery because I had to have this left carotid endarterectomy to remove the blockage that was in my carotid arteries so that I wouldn't have another stroke. So July, I had the stroke in July. I had the carotid endarterectomy in November, and every day I prayed that I would live long enough to get here to Las Vegas to see Dr. Rutledge and have the surgery. In the meantime, of course, my condition got worse and worse. I couldn't breathe. I really couldn't breathe. And Dr. Rutledge says sometimes when he says when you came into the clinic, you were as blue as the shirt you're wearing, which I was wearing that day, a blue shirt. But yes, I was blue. My pressure, PO2, which is the amount of oxygen in your blood, was 85 the morning of surgery. And the anesthetist didn't want to operate on me. He thought, oh God, no, that's not any good. And Dr. Rutledge said, well, he wanted to stop the surgery, but I said, let's wait, because as soon as they put me to sleep, my oxygen levels dropped dangerously low. And they waited. So my surgery, and as it turned out, was 70 minutes, longer than normal. When I woke up and Dr. Rutledge told me he had operated and what had happened, I said to him, well, if you had I would have been devastated if you had canceled my surgery. But I'm so grateful that you operated on me, and I thank God and Dr. Rutledge every day since, because even that very first week after I had my surgery, I could breathe better. I could walk a little further. Now I can walk, and I must admit that I don't walk very often, but I have walked up to 4 kilometers. I try to take a long walk every Sunday. I belong to a walking group. I can walk 4 kilometers. And I do have to stop and rest, but that's fine, because I don't have to stop and rest every few steps. I can breathe. Before surgery, I was a diabetic, uncontrollable diabetic on insulin 4 times a day. And I also took pills as well, morning and night. Now I'm no longer on insulin. I still am a diabetic, because as you can see, I'm still overweight. I haven't lost as much weight as I wanted, but my health is back. I'd say that I have 85% health, and I return, and I have not felt this well in the last 25 or 30 years. So even before surgery, I didn't feel well. I've been steadily getting sick for like the greater part of my adult life as I got heavier and became diabetic. And I've been diabetic for more than 25 years. And so I still have blood sugars slightly above normal. My blood pressure is now normal. At one point it was 120 over 100. And you can see why I had a stroke. I had gout. Well, no, I have gout now after the surgery. I had arthritis. I had 2 knee replacements for arthritis. I was in constant pain. What else? I had just about every complication. I have a sleep apnea. I use a BiPAP, not a CPAP. It's one step up from a CPAP. I still use the BiPAP, but I'm on the verge of really not needing it. So things have been wonderful for me post-surgery. That's all I can say. I've never really had problems. I've never I had nausea. I have not had vomiting. I was just saying that possibly I've had dumping a couple times, and only because I got really hungry and I ate too fast. I am able to eat everything that I want. I have no problems at all. And I feel really wonderful. But now, 3 years post-op, I think that I've started to gain weight again. I only lost 78 pounds. And now I've gained back 19 pounds. And now I'm thinking that if I came back for a revision, I would be able to get rid of the rest of my diabetes. Oh, I should mention my cholesterol is normal now. The cholesterol is good, but I probably would be able to stop taking the one minor blood pressure pill that I take to make my blood pressure normal. I think that I would like to just finish the job. I feel wonderful, and I plan on coming back for a revision to just lose those further few pounds. And I can't thank Dr. Rutledge and his staff and the hospital here for everything. I can't thank them enough. They all saved my life.
Thank you, Wilma.